Do most doctors take photos before Botox treatment? I recently switched physicians because I moved. My previous doctor would take pictures of me before Botox and on my follow-up appointment. The new one does not. Is it common to take photos? Should I be concerned about the second doctor's practice?
Thank you for your question. You're asking an interesting question about a contrast between doctors. You state that you had moved and you switched doctors for Botox treatment, and you say that your previous doctor took photos before treatments and after during follow-up visits. And you're stating that the new doctor doesn't take photos in the same way. And you're asking basically is this something to be concerned about? Well, I can certainly share with you my feelings about photography and the benefits in our practice and how I do what I do in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and I can certainly share with you the idea of the purpose of photos as I see it in the practice of cosmetic medicine, cosmetic surgery. So the way I look at it, for example, using the example of Botox, when I meet a patient for the first time and they want to do Botox, well, I think photos are very important to help communicate with the patient what Botox can and cannot do. So what I typically do is I take several different photos with the face at rest and then with the expression of the muscles of the areas of interest. It gives me a basic baseline of what the person has when they first came in. When I see my patients in follow-up, for example, like Botox, I'll take another set of pictures. Now, I don't do that with every patient for every time once they're an established patient. Basically, what I do is I tell patients that if you like the way the Botox looks and this is the result that you like, well, then when I take a photo of that result, it helps me understand what they prefer. So this way, as the relationship goes on and they come back for repeat visits, I have some references as to what they prefer. You know, there is such an art to what we do that I think photographs have a very important role. Now, as far as the frequency of photographs, I always ask, what's the purpose of taking these photos? As a surgeon, of course, I take photos pre and then post-operatively at different visits to document the level of a person's healing and what they look like at different stages. For hair loss, we take very regimented photos in order to establish a standard to make comparisons as the person progresses and improves with the treatment. So it's always about the purpose of the photos, and more importantly, I think, the consistency. I have had colleagues show me photos they take, and it was very difficult to see and understand what they were actually documenting because they didn't consistently do that. They took photos because they probably saw one area of interest that was important, and then they took a photo from a different angle. That's not. I don't think that's of value. I think that you have to have this conversation with the doctor you're going to. A lot of times people who have extremely busy, high-volume practices will not do this. You know, they'll have patients who come in because they got a deal or whatever. They come in, they want X number of units, whatever it is, and then they'll just do it, and then that'll be it. With something like Botox, because it wears off, it's basically kind of a safe bet on both ends. But I personally don't find that to be, I'm not comfortable with that. I feel like everybody, regardless of what I do for them, I have a set of photos that I always do, at a minimum, prior to treatment. After treatment, I make decisions as far as taking the photos, by asking the question, what am I documenting? If I do a non-incisional Asian eyelid surgery and then take a photo at 1 week, at 1 month, 3 months, it's with the purpose of documenting the progression of improvement. That's just another example. So you need to be comfortable. Whether or not the doctor has a justified reason to take photos or not to take photos, you need to be comfortable. So bring this issue up with your doctor, ask why they chose not to take photos. If it might be just a simple reason like the camera is broken, even though since everyone carries phones with cameras, I don't think that's exactly the best reason. But I think that ultimately you have to be comfortable with the doctor. I feel it's very important that people choose a doctor, and especially for like injectable treatments, and have a relationship with the one doctor, so that you and the doctor figure out what is the ideal outcomes for you, and the doctor who gets to know you and know what you like and what your personal aesthetic style is. I have patients who have been with me for years and practice over 20 years, and it really, really works to have that long-standing relationship. So I hope that was helpful. I wish you the best of luck. Thank you for your question.